Pancreatic cancer remains one of the most difficult malignancies to treat, but in recent years, a number of promising therapies have reached early clinical testing. In this session, we'll walk through 5 important phase 1 studies, sorted by mechanism of action. For each trial, I'll highlight who was eligible, the dosing, what side effects were seen, where the studies are happening, and where you can find the full protocol. Hello, I am Anna, with Axiom Biolabs. Together with our team led by Dr. John White, we are facing this giant known as pancreatic cancer. 1. Sotorasib, also called AMG 510, in the Codebreak 100 trial. This trial enrolled patients with metastatic or unresectable pancreatic cancer who had the specific KRAS-G12C mutation, after at least one prior systemic therapy. Dosing was 960 milligrams orally once daily. Among 38 patients, the objective response rate was 21%, with a median progression-free survival of 4 months and overall survival just under 7 months. Side effects included treatment-related events in about 40%, grade 3 in 16%, and importantly, no treatment-related deaths. This was a multi-center trial across the US, Canada, Europe, and Asia, with major sites like Memorial Sloan Kettering, MD Anderson, and Gustave Roussy in France. You can find full details on clinicaltrials.gov. 2. Adagrasib, or MRTX849, in the Krystal-1 basket trial. Here, adults with KRAS-G12C mutated solid tumors, including pancreatic cancer, were eligible if their disease was unresectable or metastatic, and ECOG status was 0 to 1. The dose was 600 milligrams by mouth, twice daily. In the pancreatic cohort, about 1/3 of patients responded, and median progression-free survival was 7 months. Side effects were common. Almost 97% had some treatment-related events, with grade 3 or 4 in about a quarter of patients. The most frequent were nausea, diarrhea, fatigue, and vomiting. This was a multi-center effort in the US and Europe. Details are on clinicaltrials.gov. 3. Mitazalimab plus modified FOLFIRINOX, the OPTIMIZE-1 trial. This study recruited patients with previously untreated metastatic pancreatic cancer and ECOG 0 to 1. Mitazalimab was given intravenously at 900 micrograms per kilogram, paired with FOLFIRINOX. In cycle 1, mitazalimab was administered on day 1 and 10, with chemotherapy on day 8, then every 2 weeks with mitazalimab 2 days after chemo. The confirmed overall response rate was 40%, a strong signal. In terms of safety, the most common grade 3 or higher events were neutropenia, low potassium, anemia, and thrombocytopenia. Importantly, there were no treatment-related deaths. Sites included Belgium, France, and Spain. Protocol details are posted. 4. ELI-02, an amphiphile KRAS vaccine in the Amplify-201 study. This was a phase 1 trial in patients with resected pancreatic or colorectal cancer who had minimal residual disease, often shown by ctDNA or tumor marker elevation, and carried KRAS-G12D or G12R mutations. Dosing combined fixed peptides at 0.7 milligrams each, with an adjuvant called AMP-CpG7909, escalating from 0.1 up to 10 milligrams subcutaneously. The recommended dose was 10 milligrams. The vaccine was very well tolerated, no dose-limiting toxicities or grade 3 related events. The most common side effects were mild fatigue, injection site reactions, and myalgia. 84% developed KRAS-specific T-cell responses, and stronger responders stayed in remission longer. This was tested across 7 US centers, including UCLA, MD Anderson, and Memorial Sloan Kettering. ClinicalTrials.gov identifier is listed here. 5. Autogene cevumeran, an individualized mRNA neoantigen vaccine developed by BioNTech and Genentech. In the phase 1 pilot, patients had resected pancreatic cancer and received a sequence of atezolizumab, followed by a personalized vaccine encoding up to 20 neoantigens, then FOLFIRINOX. Half of the patients mounted strong T-cell responses, and those responders showed longer recurrence-free survival. A follow-up study reported that in responders, autogene cevumeran-induced CD8+ T-cell clones, with an average estimated lifespan of 7.7 years, with approximately 20% of clones having latent multi-decade lifespans. Long-term follow-up has shown persistent T-cell immunity. This treatment has shown the best survivability outcome for metastatic pancreatic cancer patients. This phase 1 was done at Memorial Sloan Kettering. A randomized phase 2 is now ongoing internationally, comparing the vaccine plus atezolizumab and FOLFIRINOX against chemotherapy alone. You can find this trial at this ID. To recap, we saw new directions in pancreatic cancer therapy, targeted KRAS-G12C inhibitors, innate immune activation with CD40 agonists, and novel vaccines aimed at KRAS mutations or personalized neoantigens. These early trials highlight both safety and biologic activity, and many are now advancing to later phase testing. If you'd like to explore more, all of these studies can be found at clinicaltrials.gov. You can find us at www.axiombiolabs.org.